rate been at the GPHC in terms of this condition?
So we don't have data at the moment, but we do have a lot of women that I can say have achieved pregnancy spontaneously, even without help, by just counseling, weight loss, and using metformin. They're able to achieve pregnancy. A couple of women in my own practice in GPHC have been able to conceive on clomiphene, which is a fertility pill. You have There are certain conditions in which you would they will have to fulfill before going on clomiphene treatment. So, but the exact data I do not have. Now, GPHC has an up and coming minimally invasive surgery unit. So, more and more minimally invasive surgeries will be done in the years to come. And for those that are refractory to treatment with fertility pills, just drilling holes, we call them drilling. You use a small pencil with a lighter with electricity at the end to burn the ovaries, and that would improve their chances of getting pregnant by as much as 25 to 50%.
Are there at-home steps that persons can take to improve their condition?
Oh, absolutely. Weight loss, that's one of the things you can do at home yourself. Just make sure you cut down on the high energy foods, and if you're going to take high energy foods, you will have to do high energy activities to burn out the fat. So those are some of the home remedies you can do. You can also do a lot of exercises. 30 minutes exercise per day for an average person is good enough. At home, when you see that you're changing dress sizes, if it's a man, your waist size is greater than 35 centimeters, you have to be wearing a belt in the 40s. Polycystic ovarian disease does not affect me, but I'm just saying that if you're getting obese, you would have to, undergo exercises or lifestyle modifications that would improve your chances of not just of losing weight, but also increasing your utility of insulin so that the patients don't develop diabetes.
Would it be safe to say that this is a hereditary condition?
The exact cause is unknown, but you're not wrong to say that some authorities have said if a mother has this, her child can have it. Yes. So there are postulations that heredity plays a role. Yes, environmental factors like probably the lifestyle, the food you eat, people think that it plays a role, but the exact cause on its own is subject to a lot of controversy, so it's unknown.
So, Dr. Biala, is this problem prominent in Guyana?
My practice and from those of my colleagues that run the gynecologic clinic in GPAC, it is prevalent in Guyana. In case of infertility, 1 in 3 of women that come with cases of female factor infertility, polycystic ovarian syndrome is one of the leading causes of female factor infertility. When you look at those women, their ovaries are unable to release eggs as at when needed, and so they are unable to conceive. So it is a problem that is worth having a second look at nationally in Guyana, and we at GPC are looking at ways in which we can improve women's ability to get pregnant despite having this disease, because most women are born with the tendency to have the disease even though we don't know what is causing the disease.
Do you have any information you'd like to add about this condition that people should know?
So polycystic ovarian syndrome, in the initial stages, I will say again, for young girls, it seems very, let me use the word on my, it seems okay, it seems cool not to be seeing your period every month. You can go and swim without having to bloody the water unexpectedly. Yeah, but as time goes on, the inability to ovulate and menstruate regularly increases that girl's chances of developing endometrial cancer in the 50s. The fact that they are not ovulating regularly increases their chances of having insulin resistance, because that's the pathology of the disease. And when patients develop type 2 diabetes, that means that you are going to be on lifelong treatment till death. With medications, either insulin or tablets. So those are factors that you have to consider when you're looking at the fact that you're managing a case of polycystic ovarian syndrome. So the truth is, the sequelae of the symptoms outlive the disease itself. So when the ovary shut down, which means you cannot have ovarian syndrome anymore, the diabetes is still there, the weight gain or the obesity is still there to manage. The hypercholesteremia or heart disease risk is still there to manage. The psychological effects which some women would have put themselves into because of the fact that they are unable to conceive or they are unable to lose weight, depression, suicidal tendency, they outlive the disease itself. So it is a disease that needs to be brought to the public forum for people to know that they can get help and not have to go through all the sequelae on their own. And GPAC offers a lot of help in these instances, and we're willing to help women along such lines.
All right, thank you so much for shedding light on this issue, which is not only affecting women in Guyana but around the world. This has been Access Health GY, where we discuss health issues, discoveries, success stories, and more.